This information is about hip replacement surgery. A hip replacement is an operation that relieves pain and improves function in people with advanced arthritis of the hip. In hip replacement surgery, the damaged joint surfaces in the hip will be removed and replaced with metal or plastic implants.
After your hip replacement, it is important to get up and walk as soon as possible. The physiotherapist or nurse will help you on the day of or the day after your surgery to get up and walk. You can expect to walk with an aid, such as a frame or crutches, and you will start sitting out of bed with our help either on the day of surgery or the first day after. Each time you are seen by the physiotherapist, we will aim to do more with you. This will include walking practice, going up and down a step or stairs, and completing an exercise program. You will be expected to do exercises given to you by yourself throughout the day. With a hip replacement surgery, there is a low risk of dislocating the hip joint after the surgery. You should avoid extremes of certain movements, such as excessive bending of the hip, twisting of the hip, crossing the legs for the first 6 weeks following your surgery. You should also avoid any movement that causes a lot of pain. You may need to use a pickup stick, that is a long-handled stick with a grabber on the end, instead of bending over to pick up something off the floor, and take smaller steps when turning to avoid over-twisting. However, it is important that you do your exercises, so just avoid the extremes of these movements. The physiotherapist will guide you through your exercises when they see you on the ward so that you can do them by yourself. You will be given these exercises in a booklet when you attend pre-admission clinic. You should start them before your surgery so you're familiar with them, and it will help to strengthen the muscles that will be affected by the surgery. Part of your recovery after hip surgery is rehabilitation. Most of the time this occurs in your home, starting soon after returning home. Your team will organise a plan for your rehabilitation before you are discharged home.